Thank you for joining us for this webinar on early referral for Parkinson's disease. I'm Dr. Monica Skordilis, a neurologist with a subspecialty in movement disorders at Kaiser Permanente. The goal of this webinar series is to improve outcomes for people with Parkinson's disease through early referral to a neurologist or movement disorders specialist. In this webinar, I'll be discussing the symptoms of Parkinson's disease and the process for making a diagnosis. I'll also discuss early symptoms that can aid in early referral. I'll begin with an overview of Parkinson's disease. Parkinson's is a chronic neurodegenerative disorder with a progressive loss of dopamine neurons in the substantia nigra, which is located in the midbrain. The progressive decrease in dopamine affects the processing of movement in the basal ganglia, which is why Parkinson's is categorized as a movement disorder. A lack of dopamine inhibits the direct pathway and increases the indirect pathway for processing movement, leading to the motor symptoms of Parkinson's disease. The motor symptoms of tremor, rigidity, slowness, or small movement, and postural instability are considered the cardinal symptoms of Parkinson's disease. A Parkinson's diagnosis is made when 2 of 3 cardinal symptoms of tremor, rigidity, or slowness are present. It's important to note that tremor is often, but not always, present at the time of diagnosis. Postural instability, which occurs in later stages of the disease, is typically not present at time of diagnosis. Because there is no one single test that can diagnose Parkinson's disease, a neurologic exam focuses on questions about history and an examination for common motor symptoms. A neurologist or movement disorder specialist will look for cardinal symptoms and assess a person's ability to stand up from a chair and regain balance. If symptoms are present, a neurologist or movement disorder specialist will also see if a patient responds to levodopa. Despite the focus on motor symptoms for a Parkinson's diagnosis, cardinal symptoms do not become noticeable until 50 to 80% of the dopaminergic neurons in the substantia nigra have died. Parkinson's is a progressive disorder, and evidence is showing that progression through the brain leads to a wide range of symptoms, including non-motor symptoms that may be early indicators of the disease. One model of Parkinson's progression theorizes that the disease travels from the brainstem into the substantia nigra and cortex. In this hypothesis, the earliest stages of Parkinson's disease are characterized by autonomic, olfactory, and sleep disturbances. This hypothesis is supported by increasing evidence that loss of smell, constipation, and sleep problems may precede motor problems by several years. Though these symptoms are not specific to Parkinson's, understanding the wide range of symptoms from the earliest to the latest stages of the disease can support earlier diagnosis as well as effective treatment throughout the lifespan. So let's talk about the range of symptoms that are involved in Parkinson's disease, including some of the early indicators that can support early referral. We've reviewed the cardinal symptoms of Parkinson's disease, but some other common motor symptoms include micrographia, loss of facial expression, decreased arm swing, speech and swallowing difficulties, shuffling gait and fascination, feeling heavy, dragging one side, freezing, reduced manual dexterity, muscle cramping, and pain without an obvious cause. Early motor symptoms that can aid in early referral include micrographia, or small and cramped handwriting, loss of facial expression, and decreased arm swing. Micrographia and loss of facial expression may be related to bradykinesia, but these symptoms can appear even without significant bradykinesia. Decreased arm swing may be related to rigidity, and a person with Parkinson's may also notice that one arm is less active than the other when performing tasks. Symptoms may be subtle, such as infrequent blinking, but they can provide some clues for early referral. Though Parkinson's disease is still classified as a movement disorder, we now know that a broad spectrum of non-motor symptoms are associated with the disease. If you have people with Parkinson's in your clinic, it's good to know the range of symptoms because many can be managed by a neurologist or movement disorder specialist who can review and update medications and refer patients to allied health, mental health, and palliative care providers with experience in Parkinson's. We also now know that some non-motor symptoms become apparent in people with Parkinson's long before motor symptoms, sometimes decades before. These symptoms include loss of sense of smell, sleep disturbances, constipation, depression, and anxiety. Though early non-motor symptoms are not specific to Parkinson's, loss of sense of smell and REM sleep behavior disorder with no other known causes may be good predictors of risk. REM sleep behavior disorder, or RBD, is relatively rare, affecting between 0.5 and 1% of all adults. RBD is characterized by people acting out their dreams during the REM phase of sleep. A recent study found that 73.5% of people with RBD developed Parkinson's within a 12-year period. This study also found that people with Parkinson's who experience RBD have poorer cognitive, functional, and emotional outcomes. These results suggest that RBD is a strong predictor of eventual Parkinson's, as well as detection of neuropsychological deficits in people diagnosed with the disease. Loss of sense of smell is also very common in Parkinson's and present in up to 90% of people with the disease. A study found that the group of men with the greatest smell deficit were more than 5 times more likely to develop Parkinson's after an 8-year follow-up compared with men in the top 2 groups of odor identification. This is consistent with BRAC staging, which shows that Lewy pathology begins in the olfactory bulb, and loss of sense of smell may be a useful screening tool to identify people at high risk for the disease. RBD and loss of sense of smell may be good predictors of risk, but they aren't specific to Parkinson's and are difficult to use for diagnosis. But these two symptoms, in combination or with other early motor symptoms, may support early detection and early referral to a neurologist or movement disorders specialist. In summary, we now know that Parkinson's disease has a range of motor and non-motor symptoms, and that identification of early symptoms can support earlier referral to a neurologist or movement disorder specialist to to improve patient outcomes. Early symptoms include micrographia, loss of facial expression, decreased arm swing, loss of sense of smell, and REM sleep behavior disorder. In the next webinar, you'll learn about why early referral is important for better patient outcomes, increased clinical trial participation, and equity in Parkinson's care. It takes a village of providers to effectively support people with Parkinson's, and I want to thank you for taking the time to learn more about early referral for Parkinson's disease. For any questions, please contact the Brian Grant Foundation. Thanks again for participating in this webinar to support your patients with Parkinson's disease.